The practice of physicians creating formal documentation for a patient visit is a fairly recent activity in medicine. In fact, at the beginning, even journaling was unheard of as far as we can tell. In antiquity, medical care was given based on patient-reported symptoms. People were treated with rituals, prayers to drive out evil spirits, or surgery. Even herbal potions came relatively late in our history. As medical care became more commonplace in Greek and Egypt, some practitioners, inspired by astronomy, began to record private notes. But for the most part, medical care was more like getting a haircut is today. Before the invention of paper and printing, it's perhaps not a surprise that there is little evidence of journaling. An Egyptian papyrus describing a surgical case around 1600 BC serves as our first record of recording case-level information. Case reports for didactic purposes became more commonplace during the era of the Hippocratic school in Greece. The Enlightenment gave birth to the natural sciences, and with this, an interest in direct observation, anatomical dissection, and quantitative measurement. Case reports became more prevalent during this time. 2 years after opening its doors, New York Hospital began keeping patient records in 1793. Initially, the records were simple line items. By the 1800s, case reports were common, especially for surgical or complex medical cases. By mid-century, doctors at academic medical centers commonly recorded notes in case logs and journals. These notes might have been a sentence or two long initially. Even hospital records were very short. An entire month of a hospital stay could fit on one page. Much changed in medicine following the First World War. Antiseptic technique, surgical advances, blood transfusions, and X-rays were becoming commonplace. By 1925, the length increased by threefold to 6 whole pages as more people got involved in patients' care. Hospitals developed specialization with more forms, more units, more tests, and more X-rays, leading to more documentation. The modern typewriter led to an explosion of forms. Professional medical societies evangelized standards for improving clinical records. As the gap between hospital medicine and outpatient care narrowed, groups such as the American Medical Association, the American Association of Record Librarians, the Institute of Medicine, and others developed the hospital records we know today. The world is changing. New technologies for data collection and analysis appear daily. The role of caregivers is changing dramatically, including the participation of patients in their own care. For all these reasons, we can expect exponential rates of change in both what gets recorded and how it gets done.